Hi, my name's Kathy. I've had bilateral thumb replacement therapy at Spire Hospital. So I ended up with pain in both thumbs, aching continually. They were hot as well, and I had shooting pains shooting up them. I had to hold them and grip onto them to try and alleviate pain. I took lots of painkillers, which didn't really relieve it. And after 2.5 years, I decided to go to the GP and get a referral to see a consultant. I went to see the GP in sort of late April, saw Mr. Nakwe in May and had my procedure in June, then my second procedure in September. For my initial consultation, I went to the Spire Manchester. I was sent to the waiting area and saw Mr. Nakwe on time. I found him to be very approachable, helpful, and really put me at ease with the procedure I was having done. I had some x-rays and discussed all options, and then following that I went back for my surgery, where I found the hospital staff to be really helpful. The room was lovely, clean and comfortable, and then once discharged I went to see the physio Sarah, where I had exercises done with her to get the full mobility back in the thumb. Following the surgery, I came out, I had no arthritic pain. I had a bit of pain and aching around the wound site, which is to be expected. I went home bandaged, which I kept for 2 weeks, and then moved to a splint. And then about 5 to 6 weeks following, I went back to work with full range of motion. Following the success of the first surgery, I then decided to go ahead and have the second joint replacement. Speaking with Mr. Nakwe, he confirmed that 3 months post-op was the most appropriate time. I'm now 12 months post-op from the first surgery, and it has changed my life enormously. I can open tins and I can do all my household things which I was suffering with the pain. I can now swim pain-free, which I love, and I would always recommend this surgery to anybody, and I would always say use the Spire Hospital.